I'm Gabriella Pravettoni. I'm a professor of psychology at the Medical Faculty, University of Milano. And I'm director of the Psycho-Oncology Division. The fear of recurrence is really one of the biggest problems, considering the psychological point of view, of course. And it's very common, is around, in the literature they say more than 50%, but in my experience I have to say that is much stronger, and I think is around 80%. With solid cancer could be easier sometimes with patients because they could see the cancer and they could understand that the cancer is no more, for example, in their body after the surgery. It's a little bit different with blood cancer because it's an invisible cancer in a certain sense. Young patients overall, but also elderly patients. This is related to the fact that there are many moments in life in which fear of recurrence is more intensive. Like for female, when they decide to marry or not, when they start thinking to have a child, for example. There are so many moments in life in which they consider to do something particular, changing their life, moving somewhere, and they are really afraid because the oncological experience goes on and on. There are special moments like birthdays, particular moments in which we can see more anxiety in patients. But also in the daily life, in everyday life, there are so many moments in which a patient could be affected by fears and anxiety or symptoms of depressions because they have an hypervigilance, for example, on the symptoms. They are afraid of everything. Like if they feel tired, they think not that they are tired because all the people could be tired, but that is related to the oncology problems. And for example, the effect of ruminating, that is another big issue. They focus on intrusive thoughts, and they have also problems like they start of having avoidance, try to avoid some thoughts, but then they are depressed because they are not able to live without thinking and rethinking, not only on the fact of having a recurrence, but also focusing on every small symptoms, every particular that they related to the maladies. Fears could be many and very different because this is related to the personality of the patients. We need to consider that not all the patients are the same. There are patients who accept more the idea of the death, for example. So it's not focused on the fear of death for himself or herself, but the problems they could create to the others. So it's like an answer of depression because they are not able to do what they really wanted to do. We need to understand that we all have a style and a personality, and also the patient have different styles, cognitive styles and personality. There are also for everyone, female and male, young and older patients, moments in which we call it the scan anxiety. That is the moment in which they have to test, to do their check and control, and they need to go back to the hospital to evaluate and monitor on the situation. Scan anxiety is really very interesting because sometimes patients go back to their life. I mean, are able not to think and focus on the oncological experience, but will come the time that at a certain point arrives the time in which they have to do some tests and monitor how things are going. This is the moment in which they have the scan anxiety. That is hard because it's not during the days of the test, but it's something that could start even 2 months earlier than they have to do and monitor the situation. So it's something in which they are really focusing and thinking and having all these intrusive thinking on how things could go. We spoke about fears of patients, but we need to focus a little bit on all the fears that also the families, the caregivers, people who take care of the patients, they also could be afraid, and they have so many fears. For the caregivers, it's important to understand that we can really help a patient and a person of our family if first we are able to help ourselves. It's important to focus on that because the stress, the amount of stress of the caregiver could influence in a negative way the patients. Yes, of course, because as we know, when we are very stressed and under all the stressors, we improve infections, our system, immunotherapy systems is weak. And this is really a risk. So it's so important to take care of the stress that we have and we produce, because it could be very dangerous. We also see that it's not just a fear of recurrence, but we see that people that are very stressed have much more relapse. So this is not just a risk. We see that this happens. Knowledge is very important for patients because when they know, they are less afraid of things. Because they understand what happens, they understand the options they have. More they know, less is the fears they have. And this is very important also to focus on the process of decision making, because they can share with the team of experts, they can share with the families and caregivers, and if everyone understands in a better way, they can decide, make decision in the best way as possible. It is important share with experts, and this is something that I would like to underline, because sometimes people who live in conditions of uncertainty, they just go on ChatGPT, on internet, on blog, and they are not sharing with experts. So it's important to have a team to whom we can refer. Exercise, that is important. Doing meditation, mindfulness, thinking on positive aspects of their life, relaxing, and doing yoga, tai chi, all the things that they can imagine, but also to understand how it is important to adhere to the treatments, making our oncological experience a natural part of our living. There are few rules in psychology, but one of the most important is that when we don't elaborate something, we repeat the experience. That means if we don't focus on elaborating the experience, the oncological experience, with all the fears, all the angst, understanding all the anxiety and the anger, all the emotions that we have during our illness, could be that we repeat in our life all these angst, because we don't solve the problem. So we make the problems a little bit different, but the problem is still in our mind. So it's important that everyone with different personality do the best for themselves, because we have neurotic patients that like control everything, exercise, run, doing sports, and others that are more focused on relaxing, doing meditations, reading, writing their history or things that they like. So there are different tips. The most important is do the best for you, but do the best with others and with a psychological support. First of all, I think that all the patients need a psychological support, but they need to be in touch with associations, be in touch with a group of peers, for example, and focusing in living with groups of patients where they could share all the feelings, all the fears. This is the reason why it's so important to have a psycho-oncological support, because it's part of the therapy. It's not just taking pills or making scan, but is also understanding what happens in our mind, living in this uncertainty, and how we can accept all this process and solve the process. That means that our life will be better and better. Suddenly, I have to say that there is really an underestimation on the psychological aspects. And of course, it's understandable that after a diagnosis, we focus on treatment, we focus on chemotherapy, we focus on what we need to do immediately for our patients. But we need to focus also on the mind of the patients, because if we don't solve fears, anxiety, depressions, the quality of life of our patients will never be a good life. There are studies that in which is demonstrated that people without higher level of stress have less recurrence. I would like to say to the patients that fear of relapse is very common. You are normal. But you need to understand that being afraid and having so many fears doesn't mean that something bad will happen. Means that we are taking care of you and that you can live better more you think and work on yourself. And I think, and this is also important, not only for you as patient, but also for the caregivers, sharing fears, being imperfect in a world that is uncertain is much more important than being perfect.